Malaria is a serious disease. It can even be deadly. It is caused by a parasite. This parasite infects mosquitoes. Then, these infected mosquitoes can spread the parasite to humans through their bites. Malaria is a big problem in many parts of the world, especially in Africa. Every year, millions of people get sick with malaria. Sadly, many people, especially young children, die from this preventable disease. The good news is that we have the tools to fight malaria. By working together, we can protect ourselves and our communities. This World Malaria Day, let's learn more about malaria and how to prevent it. Malaria is spread by the bite of infected female Anopheles mosquitoes. These mosquitoes breed in water, and when they bite a person infected with malaria, they suck up the parasites along with the blood. These parasites then multiply inside the mosquito. When the infected mosquito bites another person, it transmits the malaria parasites into their bloodstream. Once inside the human body, the parasites travel to the liver and then to the red blood cells, where they multiply further. The most common and dangerous malaria parasite is called Plasmodium falciparum. It can cause severe complications like cerebral malaria, which affects the brain, severe anemia, and organ failure, leading to death. Malaria is a global health problem, but its impact is felt most strongly in sub-Saharan Africa. According to the World Health Organization, nearly half of the world's population was at risk of malaria in 2022. In 2021, an estimated 247 million cases of malaria occurred worldwide. Of these, over 619,000 people died, with a disproportionately high number of deaths occurring in young children in Africa. This highlights the urgent need for continued investment in malaria control and elimination efforts. One of the most effective ways to prevent malaria is to prevent mosquito bites in the first place. Mosquitoes are the primary carriers of malaria, and by stopping them from biting, we can break the cycle of transmission. Protecting ourselves from these tiny but dangerous insects is the foundation of malaria prevention, and it starts right at home. This can be achieved through a combination of strategies, each playing a vital role in keeping our families and communities safe. Education and awareness are key, as understanding how malaria spreads empowers people to take action. Insecticide-treated mosquito nets, or ITNs, are treated with an insecticide that kills mosquitoes and repels them, preventing them from biting people while they sleep. These nets are especially important for children and pregnant women, who are most vulnerable to malaria. The insecticide remains effective for months, providing long-lasting protection. Sleeping under an ITN every night is, honestly, one of the most effective ways to protect yourself and your family from malaria. It's a simple habit that can save lives, especially in areas where malaria is common. Making sure the net is properly tucked in and free of holes is also important for maximum protection. Indoor residual spraying, or IRS, involves spraying the inside walls of homes with insecticides, which kill mosquitoes that rest on these surfaces. This method is highly effective because mosquitoes often rest indoors after feeding, and the insecticide ensures they do not survive to spread malaria further. IRS is particularly effective in areas with high mosquito densities. When combined with the use of ITNs, it creates a powerful barrier against malaria transmission, protecting entire communities. And then there's larval source management, which means reducing mosquito breeding sites by eliminating stagnant water sources where mosquitoes lay their eggs. This approach targets mosquitoes before they become adults, stopping the problem at its source. This can be as simple as regularly emptying containers that collect rainwater or clearing drainage ditches. Community cleanup efforts like removing old tires and keeping the environment tidy make a big difference. By working together, we can reduce mosquito populations and protect everyone from malaria. In addition to mosquito control, there are several important medicines that can be used to both prevent and treat malaria. These medicines play a crucial role in protecting people living in areas where malaria is common, and they are a key part of the global fight against this deadly disease. By using these medicines alongside other prevention methods, we can greatly reduce the risk of infection and help save lives. Preventive medicines, also known as chemoprophylaxis, are taken regularly to stop malaria infection before it starts. These medicines are especially important for pregnant women and young children, who are most vulnerable to severe malaria and its complications. For pregnant women, taking preventive medicine can protect both the mother and her unborn baby from the dangers of malaria, which can cause serious health problems during pregnancy. In many regions, especially in sub-Saharan Africa, a strategy called seasonal malaria chemoprevention, or SMC, is used. SMC involves giving anti-malarial medicine to children during the rainy season, when malaria transmission is at its highest. This approach helps protect children during the months when they are most at risk, and it has become a vital tool in reducing malaria cases. SMC has been shown to be highly effective in reducing both malaria cases and deaths in children. Thanks to this intervention, many communities have seen dramatic improvements in child health, with fewer children falling seriously ill or dying from malaria each year. In addition to medicines, scientists have also been working hard for many years to develop effective malaria vaccines. Vaccines offer another layer of protection, and they represent a major breakthrough in the fight against malaria. In 2021, the World Health Organization recommended the widespread use of the RTS S/AS01 malaria vaccine among children living in areas with moderate to high Plasmodium falciparum malaria transmission. This was a historic moment, as it marked the first time a malaria vaccine was recommended for broad use. This vaccine has the potential to save tens of thousands of young lives each year, giving hope to families and communities in malaria-endemic regions. By combining medicines, vaccines, and mosquito control, we can move closer to a world free from malaria. Early diagnosis and prompt treatment are crucial for preventing malaria deaths. If you suspect you or someone you know has malaria, seek medical attention immediately. Malaria can be easily diagnosed with a rapid diagnostic test, or an RDT, or with a blood smear under a microscope. With effective anti-malarial medicines, most people make a full recovery if the disease is detected and treated early. Delaying treatment can lead to severe complications and even death, especially in young children. World Malaria Day, observed every year on the 25th of April, is a powerful reminder that malaria is a preventable and treatable disease. This day brings people together from all walks of life to reflect on the progress made and to recognize the work that still needs to be done. It's a moment to honor the dedication of healthcare workers, researchers, and communities who are on the front lines of this fight. We all have a role to play in the fight against malaria. Whether you are a student, a parent, a healthcare professional, or simply someone who cares, your actions can make a real difference. Malaria affects millions of people worldwide, but together, we can help reduce its impact and save lives. Here are some ways you can get involved and be part of the solution. Start by raising awareness in your own circles. Talk to your family and friends about malaria, its symptoms, and the simple steps that can help prevent it, such as using bed nets and eliminating standing water where mosquitoes breed. You can also use your voice online. Share accurate information on social media using the hashtag World Malaria Day. By spreading the word, you help educate others and inspire them to take action too. Support malaria control programs by donating to organizations working tirelessly to fight malaria, such as the World Health Organization Global Malaria Program. Even small contributions can help provide life-saving resources like mosquito nets, medicines, and education. You can also support global efforts by contributing to foundations like the Bill and Melinda Gates Foundation, which funds research and innovative solutions to end malaria for good. Advocate for change by encouraging your government to invest in malaria research, prevention, and treatment programs. Your voice can help shape policies that protect vulnerable communities and drive progress. By working together, supporting one another, and staying informed, we can create a world free from malaria. Every action, no matter how small, brings us closer to this goal. Let's make every day World Malaria Day and continue the fight until malaria is history.